Hello everyone, welcome back to my channel. So today we will be discussing about cubital fossa. Cubital fossa is a triangular intermuscular space which is situated in the anterior aspect of the elbow. We will discuss about the boundaries, contents and the applied aspects related to it. Okay, so the boundaries are apex, base, then medial and lateral margins, floor and roof. Base is formed by an imaginary line that is connecting the medial and lateral epicondyles of humerus. The apex is formed by the meeting point of pronator teres muscle and brachioradialis muscle, and it is directed downwards and laterally. You can see this is the medial side, this is the lateral side. It is directed downwards and laterally by the meeting point of pronator teres and brachioradialis muscle. The medial margin is formed by the lateral margin of pronator teres muscle, and the lateral boundary is formed by the medial margin of brachioradialis muscle. The floor is formed by brachialis muscle in the upper part, brachialis muscle of arm in the upper part and supinator muscle in the lower part. Then the roof is formed by skin, superficial fascia, deep fascia. Okay. The superficial fascia consists of median cubital vein. You can see this vein, this is the median cubital vein that is connecting the cephalic vein and the basilic vein. So this is the medial side, this is the lateral side, this is basilic vein, this is cephalic vein that is connected by the median cubital vein. And along with this we can see cutaneous nerves also. These nerves are medial and lateral cutaneous nerve of forearm. Medial cutaneous nerve of forearm accompanies the basilic vein, whereas lateral cutaneous nerve of forearm accompanies the cephalic vein. So those are the structures present in the superficial fascia. Whereas deep fascia is strengthened by a thickening called bicipital aponeurosis. Bicipital aponeurosis, that is an expansion from the tendon of the biceps brachii after getting inserted to the radial tuberosity. Okay, now this bicipital aponeurosis acts as a steady platform so that the median cubital vein lies on it, and during venipuncture it prevents, since it acts as a steady platform, during venipuncture, that is for drawing blood samples, it prevents the slipping of the median cubital vein. And then it also protects the underlying nerves and vessels. So that's all about the roof. Now we'll move on to the contents. So contents, from medial to lateral, the contents are, it is remembered by a mnemonic MBBR, that is from medial to lateral, MBBR. That means the medialmost structure is median nerve, then brachial artery, the tendon of biceps brachii and the radial nerve. Okay, so this is the median nerve, this is the brachial artery, tendon of biceps brachii and the radial nerve is seen under cover of brachioradialis muscle. So the first content, the medialmost content is the median nerve. The median nerve, before leaving the cubital fossa, it gives branches to pronator teres, flexor carpi radialis, palmaris longus and flexor deltoides superficialis muscles. It leaves the cubital fossa between the superficial and deep heads of the pronator teres muscle. You can see the pronator teres muscle here. So the median nerve leaves between the deep and superficial heads of the pronator teres muscle. The brachial artery, the next content is the brachial artery. Brachial artery divides at the level of neck of radius. At the level of neck of radius, it divides into radial and ulnar artery. The radial artery leaves the cubital fossa through the apex and enters into the forearm. It also gives a branch, that is radial recurrent artery. Whereas ulnar artery passes deep to the deep head of pronator teres. Okay, so I have said the median nerve, this is pronator teres muscle, it has got superficial head and deep head. The median nerve passes between the superficial and deep head, whereas the ulnar artery passes deep to the deep head of pronator teres. So the deep head of pronator teres is sandwiched between the median nerve above and ulnar artery below. And this ulnar artery gives off three branches, that is anterior ulnar recurrent artery, posterior ulnar recurrent artery, and common introitious artery. This common introitious artery gives off anterior and posterior introitious arteries. So that's all about the brachial artery in short. And next is the tendon of biceps brachiae. So tendon of biceps brachiae gets inserted into the radial tuberosity. Okay, and the fourth content, that is the radial nerve. A radial nerve, it passes under cover of the brachioradialis muscle. It supplies extensor carpi radialis brevis muscle, and then just below the level of lateral epicondyle, it divides into superficial and deep terminal branches. Okay, the superficial terminal branch enters into the anterior aspect of forearm, whereas the deep terminal branch pierces the supinator muscle and passes through the posterior aspect of the forearm. Okay, so these are in short about the contents of the cubital fossa. The details of these contents will be dealt in the later sections. Okay, and now the applied aspects related to the cubital fossa is that this site is used for drawing blood samples. As we have seen, median cubital vein is there for drawing blood samples for intravenous infusions, for saline infusions, for blood transfusion, and then brachial artery. For recording blood pressure, brachial artery is auscultated. So, in short, we have discussed about the boundaries, contents, and the applied aspects of the cubital fossa. It is usually asked as a short note and also asked for this discussion part. Okay, I hope you understood. Thank you.